Afternoon and welcome to the Ask a Doctor Summer Series. We're so grateful you're joining us here on our Facebook Live conversation. We want to thank our sponsors for today's event, which are the Sala Foundation Children's Hospital in partnership with Broward County Public Schools. Today, I will be your moderator. My name is Suzette Speaks, and of course, this is a conversation, so we want to make sure you drop your questions in the box below as we meet now our two medical experts that will be talking to us about what we can do to help our children with stress and anxiety. So it is my pleasure to introduce our first expert. Her name is Dr. Elizabeth Steinberg. Welcome, Dr. Steinberg. She is a pediatrician and she's with the Broward Health Physician Group, and she has special interest in behavioral health. Thank you, Dr. Steinberg. Welcome. Thank you for being here. And also joining us from Broward County Public Schools is Mr. Pedro Rosello. He is a registered nurse and works with Coordinated Student Health Services. He has also served in the military. Thank you, sir, for your service as a Master Sergeant with the United States Air Force. We want to welcome him today as our second expert.
Thank you.
Pleasure. Well, we know you will have so many questions out there watching, so make sure you drop your question below and leave a comment. If we can't get to you during the conversation, we'll try to answer you right at the end. So we'll start today's conversation with Dr. Steinberg. Can you share with us, Dr. Steinberg, what you think caregivers should do and what should they keep in mind when they're supporting their children's mental health?
So it could be very overwhelming. So I would recommend that letting the child be the guide. And it also depends on the age of the child. Younger children might need more of a straightforward answer, whereas adolescents, you may be able to have a more complex conversation with them. But most of all, reassure them that you love them and you're there to protect them, and also let them be the guide, because they may be searching for answers that are a little more simpler than what you're searching for.
Thank you, Dr. Steinberg. That makes a lot of sense. Let the child take the lead for what they're ready to discuss. Makes sense. Now, Pedro, in your experience, what is one of the things that you've found when you've worked with children that helps them when they're stressed out?
I think the most important thing that I found is listening to the child, understanding where they're trying to come from. It's better to listen, hear their viewpoints, understand what is the biggest stressor that they have, and then, providing as much of your useful tools that you've used in your toolbox throughout your lifetime to help manage those stresses and guide the child down a better path.
Absolutely. So I may take some of that advice myself. So let's go back to you, Doc. Dr. Steinberg, what about children who are struggling with the lack of normalcy? Of course, our schedules got really shaken up due to the COVID-19 pandemic. What would you recommend when children are uncertain about the lack of normalcy in these uncertain times?
It's very hard. I think every family is struggling with this issue right now. I start with a list of priorities of what you absolutely have to get done, even if it's just one thing. And let the kids help too, because if you have your list of priorities, which are very different from your teenagers, you may have some struggles in that household. So make a list of priorities together of what needs to be done and start small. You could always build up, and don't give yourself a hard time. This is really, really hard. And at the end of the day, if you're healthy and your kids are healthy and your family is healthy, you're doing okay. You're doing a great job. So give yourself some time and start slow.
Absolutely. So we'll go over to you next, Pedro. Let's talk a little bit about a question from a parent that was submitted. And of course, some questions were submitted prior to our discussion today. And that question is it better to have a student continue studying during the summer or give them a break?
I know the students won't be happy with this answer, but it's 100% of all students have the summer slide, where they're going to forget a lot of what they learned throughout the year. And then they usually spend anywhere from 4 to 6 weeks relearning a lot of the information that they've lost throughout the summer. So yes, enjoy your summer, but also incorporate some new learning techniques. Cook with your child, teach them, what is a tablespoon, what's a teaspoon. Also, you can also have them do learn a new word every week. Have them read through the newspaper as well, watch the news. Those are ways that we can continue to learn without being it. And if you do plan a summer vacation, have the student research on where it is you're going or what it is you're going to do, some important things that has happened throughout history that can also help the student learn new guidelines. So yes, they should continue to study throughout the summer. It just doesn't have to be in the desk with a teacher talking to you the whole time.
All right. Well, I know they might not be as happy as they want to be with that answer, but like my mother used to say, you never stop learning. Absolutely. Keep them busy. Well, Dr. Steinberg, how about this question? And this question came as far as children who have pre-existing medical conditions. The question says, my child has a medical condition that makes her more likely to become ill. What can I do to protect her health?
So, firstly, I applaud you for keeping your child safe thus far. It's really important to have a plan at home, not only for your child, but in the event that you get sick, of how to best care for this child. So, talk to your family, talk to your pediatrician about which office you would go to, which hospital entrance you would go to, so you have a solid plan, and that would help you make sure that you knew what was going on if and when that happens. Hopefully it does not. But having a plan is really good reassurance. Then I would also talk to your pediatrician about what appropriate medications need to be in the house if your child does get sick. And this is actually for all kids, but especially more important for kids with chronic conditions.
Absolutely. So pre-planning sounds like the best advice there. So you can leave answers and questions. The doctors and Mr. Rosello, our nurse, will be answering your questions online, but you can drop a comment here on Facebook, and we have one. This question is from Denise. How do you explain working from home to children who think they should be playing with you the entire time? Good question, Denise. Doc, you want to stick with that question?
I'm dealing with this myself, as is almost every working parent and dual working parents. It's very hard. Hopefully, you're working for a company that has some flexibility with what hours you can do. And it's also important to let kids know with very specific, simple language when it's appropriate to play and when not. And this is really where the routines come in, which is very helpful. But it is hard. Have some patience with it and take deep breaths when you can.
That sounds like some very sound advice. Create that routine and stick to it. Well, Pedro, many of us have seen a lot of pressure on parents when it comes to economics. So our next question has to do with food distribution and having food uncertainty within a household. And the question says, one parent writes, we don't have as much money these days. How do I ensure my child will have enough for food? I'll read it again. We don't have as much money these days. How do I assure my child will have enough for food?
What the county has done is actually try to be proactive. At Broward County Public Schools, we know the importance of nutrition for your mental health and your mental well-being for every child that goes to school. Broward County Public Schools, and if you notice the websites on the chat room, we'll put the links on there. Broward County Schools has 27 elementary schools, 18 middle schools, and 8 high schools that are providing lunches or meals on Tuesdays between 10 and 1 p.m. Also, Feeding South Florida at feedingsouthflorida.org also has a list of food distribution sites in the Tri-County area. So you would actually look up that area, find out their hours. You can even call them and find out, are they going to be open that day? And that will allow you to access food for your family and ensure that your family is having the nutritional meals that they need.
Absolutely. So there are resources available if that is something that you will need. Speak a little bit more, Pedro, into the what do you tell your child? Because I'm sure they're feeling and sensing what's happening in the household. How does a parent address that?
First and most important thing is to be honest with the child. Don't try to mask what's really going on there. We as parents always try to protect our children and give them the most rosy world that we can. But we also need to educate them on the reality that at this current time, the simple things, I can't buy the Breyers ice cream, coffee ice cream for you. We have to cut back a little bit. Mommy and daddy aren't working, or mommy's not working, and we can't afford to pay for that right now. So we're doing the best we can. Be honest with them and try to modify that to still be able to have their treats yet meet your financial needs.
Absolutely. Honesty, the best policy. We have another question from Facebook. This questioner says, what can I do to prepare my kid for school in the fall and not so they are not too afraid of getting COVID? What can I do to prepare my kids for school in the fall and not to be afraid of getting COVID? Dr. Steinberg, what would you say to that question?
It is very difficult, and we don't know what school's going to look like. So I would encourage parents not to tell the kid anything that they would have to take back. And it's okay to not know the answers and be honest about it. It is very abstract and it's also, let's go back a little and just say, like, these kids abruptly left their school, didn't get to say goodbye. So I would even ask them, how does it feel to have left school so abruptly? And for older kids, asking them, what do you think? So I would use it as a teaching moment and to encourage kids to verbalize what they're feeling and what they're afraid of in COVID. It may be as simple as telling them going over how to wash their hands. And so avoid misinformation, I think, is really important, and turning the conversation to them about what they think school might look like in the fall.
Absolutely. So we are all kind of in uncharted territory. So don't tell them anything that we're not certain of, but most definitely reassure them. Well, we're going to get into some other questions that were already submitted. Again, please do leave your questions here on Facebook. We want to answer your questions out there. And thank you for being a part of today's audience. Our next question, I guess we'll stick with you, Dr. Steinberg. My child is more defiant and disrespectful lately. How can I get my sweet child back? Can you just hear parents saying that? How would you do that if they're acting out?
It's so hard. These kids are processing so many emotions. We're processing so many emotions. I think it's also important to know and to recognize and to identify, how am I supposed to teach someone how to process such a complex thing if I can't even process it myself? So if you see a defiance in one area that is unrelated to the pandemic and current social events, I would still attribute that to what's going on and have some patience with it. Take a deep breath, do some breathing exercises, because what's worse than one defiant, disrespectful person is two disrespectful people. So try in that moment to relate to the child. And usually when children start to act out, it's almost a red flag for a parent or a guardian caregiver to say, you know what, this child needs a little more attention. And even if it's attention, you and me are going to go outside and take the garbage out together. That is our job, our special job. It could be 5 minutes before work or 5 minutes after work, but let the child know that you're giving them very present attention.
Very good. And it's a great reminder that their little minds are processing what's happening too, along with all of us adults. Very good. Thank you, Dr. Steinberg. Mr. Pedro, can you answer this question? It says, I have been limiting electronics prior to the COVID pandemic. Now, all of those rules have gone out the window. My child plays countless hours of video games, and of course, now there's TikTok and everything else. The question is this bad for their health?
Anything in excess is bad for you. Social media, video games, now they seem to have more time They're not able to go out as often, walk around. We know that everything in excess is in moderation. We still need to maintain the normalcy of our normal rules prior to this pandemic starting. We can't change now just because they feel locked up. We need to maintain that normalcy. We need to maintain the pattern that we'd established before them. If they were limited prior to this, so with the excess time that would have been normally filled with other activities, we as parents need to be a little bit more creative. As educators, we need to become creative and find new ways for them to channel this extra energy. Difficult when you're talking about a 5, 7, 8-year old versus your teenager who's probably using a lot of social media and doing the TikTok stuff, which is to be on my skill set. But we need to find other ways to channel that energy for them. There's multitude of things. You can provide them with establishing new chores, new guidelines, new rules, but maintaining the same normalcy. We can't allow them to say, okay, you know what? I'm done. I'm stressed out. Go ahead and go play your video games in your room until you're time. We can't do that because that's going to cause an excess. So we need to make sure we still keep it in moderation.
Everything in moderation. And I know it's tempting parents to let go of those rules, but it sounds like the more you keep them in place, the better off they'll be. Very good. Thank you, Pedro.
I wanted to echo something that you said, which is it is important to be present. Like you said, if you're on your device and they're on their device, you're not being a good role model. The other thing I also wanted to clarify is that parents should be monitoring what the children are doing in addition to the extra hours that they're having on it, because cyber security is really dangerous and children can get in touch with people that could be dangerous to them. So it's important to discuss this safety aspect to older adolescents.
Absolutely. Very good advice, Dr. Steinberg. And we'll stick with you as we start to get a little bit deeper into this topic of anxiety when it comes to children. And here's another interesting question. It says, how do you get your child to talk about their stress and anxiety? Are there differences in how boys react versus how girls react? What say you, Dr. Steinberg?
So it's an interesting comment, and I appreciate your thoughtfulness of it. But what I would like to bring attention to that at all ages and gender and all different types of kids process anxiety differently. And you know best how your child likes to talk or what makes your child happy. So similarly, as if I were talking about age, there would be what we talk about with 5-year-old kids and what we talk about teenagers might be different. For you as a parent, you may find that talking in one way to your son is different than talking in how you would go about the same thing with your daughter. There's of course differences between everybody when talking, but I find it hard to say that blanket boys are one way and girls are another. But I also want to address that for adolescents, they really have a good idea of what they're thinking about, and you want to talk about what you're thinking about. But adolescents are super smart. They're smarter than us. So I would make sure that if you want to have a heart-to-heart, you're worried about them or they're upset about something, make sure that it's on their time and set that time up so that you're not bombarding them when they're trying to be private. So as long as they're safe and you don't have any concerns about safety, I think it's reasonable to let them be and ask them when they would prefer to talk about it.
Absolutely. So it sounds like let them take the lead. And sometimes parents do that inadvertently, or caregivers do that inadvertently and start where they are. And that might not be where your child is. So we definitely have to be aware of that. Thank you. Pedro, this is an interesting question because not only is the pandemic of COVID-19 presenting some challenges of anxiety and stress, there's also all this news going on regarding discrimination and protests. So children are taking a lot of those images in. So our next question asks, how do I address the events and discrimination my child is seeing in the news? What would you say to that?
Well, what I did is I actually looked into our equity and diversity department at Broward County Public Schools, which takes care of a lot of that for us. And I'll begin with a quote that was written by Eleanor Roosevelt. For it isn't enough to talk about peace, one must believe in it. And it isn't enough to believe in it, one must work at it. The issues that are in the forefront of national news and community dialogue brings a lot of fear, a lot of confusion, and is present in many of our youth and communities. As a result of racial tensions, bias, and oppression and ignorance in our nation, Broward County Public Schools is working on a structure for the forum for our students to be able to express themselves appropriately and understand what the current fear that these students are suffering with the current situation.
Very good. So we know the schools, therefore, are being proactive. I'm going to allow Dr. Steinberg a quick follow-up. This second part says, when my child gets scared, or if my child gets scared when talking about current civil unrest, should we stop talking about it?
It's very sad to hear that parents are talking about these things with their kids, and I am honored to be a part of that conversation and being asked about it. But I think it is very different for every family, and you know your child the best, and you know what their limits are. I think that it's more than time that we have these conversations and identify that there is differences in race and that we identify our biases and explain those words with the kids when they're capable of having these conversations. So you know best, but if we are able to identify racial differences and biases, we can have more open conversations about hard topics.
All right, thank you for that. And we know that's not an easy conversation, parents out there watching. So thank you both for your insight there. We have another question from Facebook from Cindy. Thank you, Cindy, for asking. What do you say to an 8-year-old that makes himself feel sick, worrying about his mom getting sick and passing away? What would you say to that, Dr. Steinberg?
That is very, very sad. And I think that I would definitely seek help in a situation that is just so heart-wrenching, yet sweet, but still heart-wrenching, because something that this child saw or heard really did disturb the child. And I would be concerned about making sure that that child is adequately talking to someone who is a professional, a therapist. So that would be actually a child I would want to see in the office and make sure that the child feels safe.
Absolutely. So we have a lot of questions that came in about masks. So we'll start with you, Pedro. Does my child have to wear a mask all the time? Big question now.
Well, to define all the time, I would say not all the time, but definitely when the potential for possible exposure, being in a large community area, especially with the phase 3 opening up soon of the Broward County, definitely wear the mask when the possibility for being exposed to the COVID-19, reinforce hand washing, hand sanitizing. So yes, should they wear the mask all the time? They should wear it when the high possibility that they're going to be there. So if they're in the supermarket with mom and dad, they're walking around the store with mom and dad.
I have a more specific question. Sorry for interrupting. Let me add on. This next question says, which is related, is it okay for my son to play outside with a small group of friends without a mask?
What I would say to that is, as a parent, we need to be aware of who our children are playing with. We need to have an understanding of what their exposures are, because again, the symptoms are not present for 2 to 14 days. There are some asymptomatic children, or let me rephrase, there are asymptomatic people out there, so we know that they have the COVID-19 virus. So as a parent, you need to be aware of who your children are playing with, and then you need to assess, is it going to be a safe environment? Because if they're being physically active and wearing a mask, that can cause some difficulty, trying to catch your breath, so forth and so on. It might be difficult to go and play through that. So as a parent, assess the situation. If it's within your neighborhood, know who they're playing with, know who their parents are. It's hard to tell who's everybody been exposed to. but still, if you understand your neighbors and you know that they've been maintaining the quarantine and on the right tools, then yes, I would think it'd be okay.
Sounds like it's a tough call. Sounds like it's a tough call, but you have to know who your kids are going to be exposed to and obviously assess the risk of exposure. Okay, Dr. Steinberg, it's summertime. So a lot of people are looking at registering for summer camps. So the question we have next is, as summer camps begin reopening, is it safe to register my child? What would you say, Dr. Steinberg?
I would have to agree with Pedro on this, is that you have to assess what is best for your house, and you're putting your child in a community situation that you don't know what you're doing. So I would say it would be based on how comfortable you are. I think there's guidelines, and then there's also people who are being a little more cautious than the guidelines, and then there's people that are being not too cautious at all. So you have to find out where you are in the mix. So I would do what you think is safest for you and your family.
Okay, we have about 5 minutes left, so we're going to turn back to our main topic of stress and anxiety. Pedro, we'll go over to you with our next question. Lately, my 13-year-old son has been biting his nails, and I think he's stressed out. How do I get him to stop? What would you say?
Well, the first thing, I think the most important thing is to find out why he's starting to bite his nail. Talk to your child. And he's 13 years old. They get inundated with a ton of information, current situation today, all the news, the COVID-19. I can't be out with my friends. I'm stuck in this house. So there's a lot of reasons why this 13-year-old has referred back to biting their nails uh, as a form of anxiety and stress to relieve that stress. So you need to talk to them, need to ascertain what it is that's getting to them. They may not feel free to speak their emotions clearly, but try to understand it. You know your child the best, understand where they're coming from, and then try to mitigate some of that stress and anxiety by providing them with the education that they need. Have them understand better, and then they can better cope or have a different coping mechanism to work on that stress.
Absolutely. And we'll leave you with this last question, Dr. Steinberg, as we begin to wrap up. My 4-year-old has been acting out and having more temper tantrums. Could she be stressed?
Definitely. She's very, very stressed, and she can't communicate very articulately how to deal with that stress. So this is where I would take a moment with the child, help her through the tantrum, be calm, and then spend extra time with her going over what she was going for. Because I do see a lot of kids who are acting out, that it's actually because they're trying to get attention from you. So maybe you were on your phone, or maybe you were talking to your spouse, and that's why she was having a tantrum. Or maybe it's not. Maybe that happened yesterday and she's having a tantrum today because of it. So I would give that opportunity to spend some quality time with her. And if that means a longer bedtime, an extra book, that's what I would do. And the other thing I wanted to mention about the nail biting, to going back, was that in terms of any medical concerns, that if you notice your child eating items, that even the nails, to have it evaluated, because it may be a sign of pica.
Okay, very good info. Thank you both. Well, we're definitely going to have you guys back. We were going to wrap up with some great resources for parents who are, again, you have so much on your plates. Thank you to all the caregivers and parents watching. We wanted to leave you with some more information. Real quickly, Dr. Steinberg, obviously you're a pediatrician with Broward Health Physician Group. How can any of our folks watching or any new patients get in contact with you?
So you can call the office directly. Now is a great time to see the pediatrician and me, because there's little to no wait time, and have extra measures to keep everything clean. My phone number at the office is 954-217-5720.
Very good. Thank you. And again, thank you so much to Mr. Pedro Rosello from Broward County Public Schools. Can you tell us if there's any other mental health resources for parents to use in order to ensure their children's well-being this summer?
That's a great question. We do have a great mental health department. My director, Ms. Marcia Bino, and our chief of services, Dr. Hickman, they work diligently to create within my department, coordinated student health services, a mental health department. So our nurses are aware, and we're going to put out there nurses, the social workers, school counselors, um, and there are also psychiatrists and psychologists that are working with Broward County Public Schools to provide them with those tools that they need. There's also on our Broward County School website mental health tools to work with the students that deals with everything from the current situation to COVID-19, or any other underlying issues that our youth are dealing with. So there is
BrowardSchools.org.
BrowardCountyPublicSchools.com. On our Broward Schools website, there are excellent resources for mental health and tools. There's the phone numbers for suicide prevention.
You actually, sir, I was just about to mention it. Thank you, Mr.
I'm
Rizzello.
sorry.
You guys took the words out of my mouth. So we wanted to also, of course, let you know, stress and anxiety is something that everyone who is going through this pandemic and all the other stressors are experiencing, including our children. So of course, if you see that you need critical care or there is some threat of suicide, we do want to give you the suicide prevention number, as Mr. Rizzello was about to do. And that number is 1-800-273-8255. I'll say it again, 1-800-273-8255. Of course, if you feel like there is a extreme emergency, do not be afraid to call 911. We've had so many great questions today. I'm sorry, we do have to wrap up now, but we want you to mark your calendars for our next Ask a Doctor. We have it scheduled for June 17th. So please mark your calendars, June 17th. That will be our next conversation. We have another great pediatrician Kettesburg will be joining us, and we'll be talking about healthy eating habits. So that's another great topic I'm sure many of you caregivers would like to explore. All righty, so we want to tell you, last but not least, that we have a Nurses Connect phone number. So if you're not aware that we at Broward Health provide Broward Health's Nurses Connect, basically a phone number where for 24/7, 7 days a week, registered nurses are there to help answer all of your medical issues or your medical questions. So you can please contact them if you don't know what to do at 954-320-5730. Once again, Broward Health Nurses Connect. Nurse Connect is 954-320-5730. Again, they can answer any medical questions you may have, or you can schedule an appointment. And last but not least, being healthy does not stop just because we're in a pandemic. Actually, it's even more important now. Some of us have unfortunately had to put our health and our children's health on the back burner, but now is the time to start to refocus on health and making sure our young people stay healthy in every sense of the word. So if you want to make an appointment, again, for a wellness visit or anything that you may have, our Nurses Connect is very important, is a very important resource for all of you out there. Once again, that number is 954-320-5730. And lastly, I said that before, but Broward Health wants you to know that we have been maintaining the most strict CDC guidelines when it comes to safety visiting any of our facilities. So please be aware that we're here to serve. And if you need to make an appointment, we have enhanced sanitation, enhanced safety measures, and we will be doing universal screenings of every employee coming in and out. We are masking, all of these things to help ensure our patients' well-being. So we hope you've enjoyed today's discussion. I was excited to be here. Thank you for having me as your moderator. I'm Suzette Speaks. That's it for today's Ask a Doctor. Thank you so much for joining us. We'll see you soon.